Hello, everyone. Welcome to this TechNet 21 webinar series on capacity development and professionalization. Today's 1-hour session is going to be focusing on communities of learning, the role of country chapters in driving supply chain capacity development and professionalization. The session is going to be presented by Walter Proper, IAPHL Executive Director. You can, if you wish, listen to this presentation in French. To do so, please select the globe at the bottom of the Zoom window and then choose the desired language. And you can flip between languages if you wish. You can also use the chat box to introduce yourselves and tell us where you're from. And you can use the chat box as well if you need any technical support, and we'll do our best to help you, for example, if you can't hear what we're saying or if there's a problem with the translation, etc. If you have a question regarding the presentation itself that you'd like to ask Walter, please use the Q&A box that's also available at the bottom of the Zoom window. You can ask your question at any time, now, during the presentation, or even during the Q&A, and our panelists will answer them during the Q&A session at the end of this presentation. This session is being recorded, and we'll share the links to the recording on YouTube, as well as the links to this slide, the slides that are going to be presented once the session ends. So I think that's all I have to say. And now I'll pass it over to Walter. Walter, you have the floor.
Thank you, Dan. Hello, everyone. I hope everyone's having a good day, good morning or afternoon. I am hoping that my colleague, Jacob, our IPHL Ghana country chapter leader, will be able to join us. He may be having some technical difficulties, but if he can't, then I will also...
Walter, I'm on now. Sorry.
Jacob, thank you.
Yeah.
Welcome. Okay, excellent. Good. Okay, so then I'll go ahead and proceed on this. So first, again, what is IPHL? It is the International Association of Public Health Logisticians, and we were started in 2007. It actually came out of a international training that JSI did in South Africa, and then the people who were attending the training said, well, what next? How do we stay in communication? How do we continue our learning and helping each other? So IPHL was started, and so it was to look at promote the professionalization of the field and really this education and information sharing. We support people all over the world. We have about 150 countries. Right now, there's close to 8,000 members worldwide. Our people come from all levels in the supply chain, all the way from very senior people. I think Jacob may remember at one time, Ghana's maybe 3 ministers ago, ministers of health actually used to add stuff to the communication, the community of practice, and then going all the way to people who are down to the lowest levels in the health center. The vision, we're a world where strong and well-run supply chains reach all people with life-saving products. The mission is really to enable those people working in public health supply chain, especially in the Global South, to connect, learn, and succeed. And I would say also to recognize their importance. So current membership, as I said, 7,700, a little more than that. We continue to grow. We've had more than 600 new members this year. Our ratio for male to female is, for those who click those boxes, is 69% of the members are male and 31% of women. We've gone up 1%. We hope to increase that a bit. And the key sectors, probably as much of you as like in the audience, come from NGOs, the public sector, lots of Ministry of Health people, private sector, and academia. One of our newest growing areas are students who are in the universities now and learning or thinking about their master's thesis even, what should they write about? And I think they have found that the community of practice is extremely helpful when they ask the question, and they get a lot of answers from around the world to help them. So just again, by region, clearly Africa is 70% of our members come from Africa, but we do have, our footprint in Asia, even Europe and Pacific Islands a bit. Latin America, we have not been able to reach them as much, but we do have some members who come from Latin America. So country chapters, which this is really about, is, we consider them such an important aspect of what we're doing. And in my mind, they are the future for IAPHL. And each national chapter is considered a branch from us. So they are led by volunteers in that country. The Secretariat gives what support it can. There are currently 26 active IAPHL country chapters. And again, some of them are being managed and run. They have maybe 4 very active people, and others 342 members, although I think that's out of date now. I think we have a chapter which has over 500 members now. We support them with face-to-face networking. There are chapter leader meetings every month. We provide professional development where we can, certainly information sharing, mentorship at the country level. Most recently, we conducted an advocacy training for our Zimbabwe country chapter. So these are the chapters. I won't go through them, but you can see we are around the world. Again, heavily in Africa. And the biggest and newest growing area, I think, is our Francophone countries. So if you see fairly new chapters, we have Congo, Indonesia. Some of our very newest are coming out of West Africa and Francophone Africa. And we're in conversation with these others, these prospective ones. We've had conversations with Jordan. I know Senegal is coming on, the Comoros, Madagascar. So these are all we expect that will become chapters. Just to say again, one of our newest chapters, Indonesia, just conducted their own webinar and had over 480 people participate. So some of the things that they're doing, because it's all about, what are they doing? And so our South Africa, they've engaged local international experts to share their expertise with members through webinars. I would also say our South Africa chapter has really been reaching out to the youth. Nepal, among the things that they're doing, they're working with 2 of the universities who did not have public health supply chain in the syllabus for pharmacists and pharmaceutical schools. So now that's there. Tanzania, using the webinars to educate members on the basics of vaccine supply chain. Cameroon did a great contest, virtual game contest for supply chain people. It went very successful. India also held a contest. I was one of the judges, and very interesting information about how different organizations and people address the COVID pandemic and how they did it, and really shared some very interesting insights and new ways to address things. Nigeria, held a full day workshop of their own and targeting young chapter members. Nigeria is one of our largest chapters. Ethiopia is sort of our 2nd largest chapter. They've held a workshop on supply chain and posted the terms of the day for the members. So they've been really educating their members and conducting full workshops. Benin is, developing a strategy now to really recognize supply chain workers, which is part of our main day. That's sort of that professionalization. And with professionalization, I think it's the recognition that's needed, especially for many of our members who are not part of a pharmaceutical association or a biomedical association. IAPHL offers that network, that group, and that recognition. Zimbabwe has done their own workshops, online training modules in warehousing, distribution of good practice. And as I just said, we just recently conducted an advocacy training for 15 of its members, and they are already moving forward in their supply chain advocacy strategy. And other chapters are all putting efforts in developing their communities and chapter strategies. So I'm going to turn it over to our Ghana chapter leader, Jacob. And Jacob, it's you, and I'll do the clicking for you.
All right, thank you so much, Walter, for presenting and highlighting what IAPHL stands for. Ghana chapter, we have been doing a couple of activities just in line with what Walter just represented over the years since 2019, when we got the Ghana chapter launch. We've been working very hard to see how we can get the Ghana chapter aligned with the supply chain community. So what the first thing we did was to regularize our legal status by registering as an association in Ghana with the Registrar General Department. And since then, we have been able to work with other agencies. And through the support from our small grant project, I think that has projected Ghana's chapter with so many other organizations getting interested in what we do. So we had over 70 in-person participants, and then also 80 online participants during our maiden small grant project that we did. And it was based on some of the IAPHL initiatives. The Ghana chapter was able to run this workshop, which was hybrid, and we had almost all the stakeholders from Ministry of Health, Ghana Health Service, and our development partners, Chemonics and other partners, especially Chemonics. They are running the Global Health Supply Chain Program funded by the USAID. So we had a lot of these guys coming on board. Just to make sure that our works are in line with the procedures and other regulations in Ghana, we had to adopt a constitution that reflects what we are in to do as an association. Also, next slide. We've been also through, because of COVID, we adopted the online meetings, which is helping us to kind of interact with our members across the country. In terms of capacity development initiatives, we've had a couple of workshops, and I just highlighted one from the previous slide. The workshop was based trying to see how we can sustain the supply chain performance improvement within the public health sector of Ghana. And we highlighted on the various regional, national, district related perspective of supply chain in Ghana. We tried to also highlight the key interventions that are driving the health sector supply chain performances in Ghana. And then we looked at the supply chain monitoring evaluation framework in the Ghanaian context. And then we tried to look at which areas do we need to prioritize so that we can have those key performance indicators aligned to the members, so that those practicing in the various hospitals can actually help towards the realization of those KPIs. And then lastly, how do we sustain the gains that we have made? And because we just came out of COVID. Next slide, please. And we needed to see how, based on the successes that we've struck, we were able to move that. Then we also recognize the need to look at value-based procurement, because Africa in general, we don't have the financial power to procure very high quality medical equipment from countries that have been certified to producing these products. And then also coming to the fact that we have a lot of political interferences in terms of procurement related decisions. So we don't end up getting equipments procured, equipments that will last over a period of time. So we saw that this was a big challenge that we needed to get our members also sensitized on. So we had this workshop, which was to kind of help create that need for us to consider just beyond cost or price of the equipment, but look at a broader coverage of value issues, value for money issues, so that at the end of the day, the equipments that we are procuring for our health hospitals and clinics will last and deliver accurate results or diagnostics that will help impact and improve the healthcare delivery in Ghana. So that was basically about this workshop. And we had a case study from the 37th Military Hospital that we all learned how they go about medical equipment procurement, and we saw the gaps, we saw the weaknesses, and we shared ideas as to how to improve upon these things going forward. Next slide, please. So this also was on trying to see how we can improve upon health service management. We know that customers, clients, or in other words, patients that attend hospital deserve better. So one of the needs that was recognized was to look at how do we improve service management in the hospital from the patient perspective, and by ensuring that we sensitize our members to understand that the services being run are supposed to be for improving patient or client satisfaction. So with the support from the small grant project, we held one of these workshops to be able to provide knowledge in this regard. Next slide, please. So as part of our capacity development initiative, we also attended this in line with the customer service workshop I talked about, and it was just to highlight the various complaints that patients bring to hospital, the need for us to have proper customer service. What are some of those that mentions that patients look at to say that hospitals are providing them with quality service or not, and then what the barriers to such quality services, and how do we improve upon these quality customer service related initiatives. And then we highlighted the need for hospitals to develop customer service strategies or plans to be able to provide their customers these services that will make them receive the best of care and be happy to visit them again. Next slide, please. So we, based on the global, the broader goal of IAPHL as highlighted by Walter, we decided we needed to work with other professional bodies in Ghana, such as the Pharmacy Council. Is a body that regulates the practice of pharmacy in Ghana, and then they are also playing key role in the health supply chain. And therefore, we decided that because IAPHL, by our design, we need to provide peer-to-peer learning, capacity building, and related activities. We recognize from our previous capacity building programs, pharmacists and other cadres of supply chain practitioners had challenges participating because they wanted to be sure whether our activities count towards some points that will help them renew their membership or their license and all that, because it's a requirement from some of these professional bodies. So we were having recognized that gap. We decided to engage these professional bodies to see how we can collaborate and partner with them, so that most of our workshops and training that we do, their members can join at free will, because participating in IAPHL events will count towards points that will help them achieve some membership, license renewal in the coming year. So these bodies are also, IAPHL Pharmacy Council is one of them. And then we also have given the necessary documentation to that effect. And just last week, we needed to renew our membership, our accreditation with them for 2023. And I got the forms delivered just within this week as I speak. The Chartered Institute of Logistics and Transport is also a formidable supply chain community of practice in Ghana. And we have members from the health sector, public health sector, private health sector, and manufacturers. Some of them are part. So we also recognize that this is a body we needed to work with. So that is one of the window we want to see how our members can also benefit. Then next slide, we also had collaboration with the Center for Applied Research and Innovation, Supply Chain Africa, which we call CARISCA in short. And that is also a USAID funded project with the Kwame Nkrumah University of Science and Technology. The whole program, the whole of that center is geared towards promoting supply chain excellence in Africa. So IAPHL was recognized as one of the industry partners because of what we do. So currently, as I speak, we have an MOU with them to support that center with our expertise. So most of our members are recognized as facilitators during their CPDs. We also get concessions to work with them, develop curriculum as we speak. And then they are running some CPDs, some degree programs, and master's programs that IAPHL contributed to the development of the curriculum that they are actually are using to run those programs come next year. So that is the extent to which IAPHL Ghana chapter have worked with professional bodies just to make sure that we deliver our core goals and then mission and vision as Malta highlighted a couple of minutes ago. Membership-wise, we just started from 0 in 2019, and we are 300. This number has changed. We are currently about 280 plus, and our goal is to hit 300 by the end of the year. And all these are made possible through IAPHL initiative, especially with a small grant project that they support country chapters to be able to run workshops and related activities for members. So these are the few highlights I would like to share. Next slide. I don't know whether there's anything left there. Walter?
Yeah, I'll start the next one. So thank you,
Sure,
Jacob.
Sure. Thank you so much.
So as you can see, this one chapter, a very active chapter, has done quite a bit in capacity building and professionalization. And this is all run by volunteers that make it happen, but it's the people who are there in the country who know what their issues are and have become a recognized force to discuss issues, to be recognized by the Ministry of Health and others in terms of the potential that they have to really help in addressing these issues. So I'm again, just congratulations to our Ghana chapter. It's not going, there we go. So again, just as this is the potential. The chapters are the future for IAPHL. We hope to continue to grow these chapters. They represent every level in the system and bring that, and you just heard in the case of Ghana, they're recognized for the events that they do, that you can get credits where you need professional credits now. I think something else that even Ghana has done is what we call the seat at the table, where ministries of health are inviting our chapters to come and work on national commodity security strategies or our supply chain strategies, and they come as IAPHL. And so I think that's another great potential for the chapters, is seen as sort of an objective group representing so many different people working on the ground, and probably people who not always listen to. And so IAPHL provides that avenue. And again, now the news is to advocate for supply chain profession in their countries and supply chain activities. Again, advocacy, we see this is another great potential for our chapters, because it's the people who are there on the ground doing the work, and ministries know them and others know them and know that there are people that represent every level in the system. And so I think this is where it is. This is the great potential. And we hope that chapters are growing and doing so many things. And again, then on the international side, again, we are hoping to get more and more of this information out, to go out to all of our 8,000 members to share what's happening in the chapters. Many of the chapters have very, very active WhatsApp groups, but that we're trying now to get them to share more on the international listserv, because there's some great discussions going on and sharing going on. So with that, I would say, if you're not a member of IAPHL, you can join for free. It's quite easy. And you also, when you're joining, you can also join a chapter if your country has a chapter already. And if your country doesn't have a chapter, then start talking to us about forming a chapter. So I think we're ready for questions and answers. So I see one question is how to register an IAPHL, and can you share contacts of the Africa region? Yes. So one is do, as I just said, register, sign up and become a member of IAPHL. And then again, this is how, it's as simple as that. You will also see when you become a member and you're approved, then you'll be able to see the chapters. and then you can contact the chapters to sign up to be in the chapter. And then you can always contact us, the Secretariat, at IPHL. What is it? Yes, IPHL.org. Yes, and we will answer your questions if you're trying to join a chapter or to help you find the chapter leaders. And once you join, even if you put it on the listserv, then the chapter leaders are reading that and they'll get in contact with you. A very good question. Is it only pharmacists that are allowed to join? Absolutely not. We have a lot of pharmacists, obviously, because of the nature of the work, but we encourage all kinds of members, and we have pharmacists, occasionally doctors, lots of nurses. We have biomedical scientists, lab people who join. We have people from NGOs, consultants, advisors, and other people in the Ministry of Health who are very interested. And those of us who are working in supply chain know that, you know, supply chain involves so many people who may not have it in their title, even in their job description, but it is their work. So we really encourage all and the outreach to go not just to pharmacists, but to all kinds of people working in supply chain. So I have, sure, the webinars are too good to miss a word. Thank you very much. And again, we do, for all our webinars, we do put them on our website, and we do, more importantly, they're on YouTube. So you can find them on YouTube. And I know this one will be recorded by TechNet and shared with us. And so you'll be able to find it through the TechNet YouTube, and you'll also be able to find it through the IPHL YouTube. Okay, so Jacob, you take note that Hamza Bagorbiri wants to be contacted by the chapter leader, which is you. Let's see.
Okay, yeah, I think I've just responded by the chats.
Excellent. Okay, great. And I don't see any new questions. Yeah, there was one in the chat. Okay. So any other questions? Again, we are a very inclusive organization. I would say that at one time, an outside organization was looking at communities of practice, and then told us that one of the things they found with IAPHL, that we were the most collaborative community of practice that they looked at, which was great to hear. So we do get into debates, but I think people are very cordial to each other and collaborative, and there's a lot of sharing regardless of what organization they come from. People are ready to share information, and the best is when people are asked direct questions, they get a lot of answers back. Let's see, I don't have Q&A, I have a chat. Yeah, so how can you post, in this Q&A, I think you just posted in the Q&A. I think this is what you're asking about.
Hi, Walter. This is Dan. Yeah, I was just asking someone who raised their hand to make their post in the Q&A. But while I have the floor, I did have a question myself, and it was just around, is there a connection between country chapters and national logistics working groups in countries, or is there a sort of some kind of framework for these interactions to take place? Because it seems like it could be something that would be a very fruitful connection between the two.
Well, I think Jacob in our Ghana chapter has led the way in this. That I don't know, Jacob, if you want to have a few words, because certainly the Ghana chapter, as I said, has had a seat at the table.
Yeah, we you know, our chapter kind of have membership that cut across the different levels of the national health supply chain. So from the national level, regional level to the district level, our membership cut across. And also, thankfully for us, most of our members have training in terms of academics have advanced to masters, some few about 2% are even in doctorate, and they serve at the regional and national level. So when opportunities come for it, especially in procurement tender committee, some of our members are serving at those levels. And fortunately, because we wanted to kind of have IAPHL, promoted across various supply chain community of practice, so we kind of have a mixture of members cutting across the different levels of the national health supply chain level. So from the central medical stores, we have our members across. The regional level, we have our members across. So that is the extent to which our members are embedded as far as Ghana's public health supply chain is concerned. So depending on the level that there's a need, you find an IAPHL member playing a key role at that level. I don't know whether I saw a question about why we registered as a limited liability, a company limited by guarantee. For the registration of country chapters, it depends on the prevailing rules in your country. And in our case, we could not register as a limited liability company. It's an association. And per the laws of Ghana, we only could register as a company limited by guarantee. And that is what more like to do with an NGO or a charity or an association. So that is the level that per our broader goal and mission as a group, that's where we were permitted to register our association. So we are not into any profit-making organization, but just a group of professionals trying to meet, connect, share knowledge, research, and try to help contribute to a public health supply chain in Ghana, if that is okay for a response. Thank you.
Yeah, I think the next question is for you as well from Karmit. I'd be curious to hear about the culture of the Ghana chapter.
I don't know what he meant by culture, but I can imagine he is referring to how we are able to relate to each other, how we are able to coexist as a community of practice. What I can say is that looking at how Ghana's geographical, demographics are, we cut across different, regions, and that is why it's when we introduce the online meetings, it kind of elevated and made it possible for members across the almost 16 regions in Ghana to connect, because it was practically impossible for IAPHL Ghana chapter to fund transportation of our members across the region to a central location. So once we introduced a hybrid, it made it possible for members. And also because we created that unity of purpose that, look, regardless your level in terms of practice, whether at the district, regional, or national level, there's a platform that everybody's view or opinions matters. So it doesn't really matter your level or position, but so far as you have a problem that borders on your work, which you need solution, the solutions that we get sometimes don't really even come from the big guys, but within the network of peers. And that is the kind of culture that we have built for ourselves as a community of practice in Ghana. So if I were to understand your question from the culture perspective, this is what I want to share with you. Thank you.
Thanks. And again, I think that culture that our Ghana chapter really represents, and listening to everyone and everyone has a voice, is again going back to the heart of IAPHL internationally as well. Everyone has a voice, and everyone is looking at it, brings a background, brings information, brings their experience to the association, and the Ghana chapter really represents that. Okay, I don't see any other questions. Yeah. Okay. So again, I would, please join if you're not a member. It is free for now, and then chapters, some of the chapters most chapters are not charging now, but are looking at charging a small fee for some of them to stay there. I know that Jacob has mentioned our grant program. We were fortunate to have funding from the Bill and Melinda Gates Foundation to allow us to give small grants to our chapters. USAID remains as our main baseline funder that keeps the base of IPHL going. We are hoping that next year we will maybe receive funding again from a donor to continue this very successful grant program, which again is very small, but has really helped many chapters do some really interesting and exciting things. And again, I think that's where the capacity building is going to be. That's where the professionalization and the recognition of the people doing this work and how important they are and to be recognized for that work. And that's going on. And of course, that's also part of our advocacy strategy that we're hoping to also continue supporting from the Secretariat side next year as other chapters can receive training and go forward with advocacy, development of their own advocacy strategies, which is their strategy, which is what they feel they need to advocate for.
Yeah, Walter, can I say something as far as those that want to set up their country chapters? As Walter indicated much earlier, the whole business of IAPHL is one that is voluntary. You need to sacrifice your time, sometimes your resources and all that. So I want to encourage those who are listening to us and have the desire of setting up country chapters. Once you have the drive, once you have the passion that you want to contribute something to your country's public health supply chain, that should be the main goal that drives what you want to do before other motivational issues will come. Otherwise, trust me, you will start. Initially, you may have the euphoria, you may have members clouding around, oh, we are interested, want to join. Then the next moment, everybody falls back. Then you are the only one in the life. I want to encourage anybody that wants to set up. Don't really be afraid about numbers. Numbers don't do the trick. It's about the desire and passion to succeed. So once you start your country chapter, it doesn't matter the numbers. You can start small, 5, 10, 15, but it is about the contribution you are able to make to your country's public health supply chain that matters. So don't be afraid that we may not have numbers. I'll not get people to support me. No, the most important thing is try as much as possible and be driven by that motivation, that passion that you want to contribute something of value to your country's public health supply chain. And I think that will help you move forward. Again, those of you who want to set up, that is the point you have to begin to use your social capital, your network of supply chain practitioners you have. That is where you begin to connect. If you connect one, it connects to the next one before you realize you become a big family. So these are the few things I want to share with those that have the ideas or the intention of setting up country chapters. You need to know that this is sacrificial in the first place. Nobody is paid for what we do. But once you have the passion and the drive to contribute, nothing will stop you from moving forward. Thank you very much.
And thank you, Jacob. And yes, it does take work. I think there is the recognition that comes with that work and the fact that you're helping your country. And certainly Jacob has led the Ghana chapter to do some really great things. I did see one other question. I'm sorry. I think we're ready to wrap up unless I saw a hand, but it went away. So I don't know if they put a question in the Q&A. I don't see it. Okay. So I think, Dan, we can wrap up.
Great. Thanks, Walter. Thanks, Jacob, as well, for those interesting insights into the importance of the country chapters. It's definitely really, well, seems like such a kind of growth area and an important component of IAPHL. Hopefully it will continue to thrive as it has already done so. So we'll continue this webinar series next week. It continues on the same day and the same time. That's 3 p.m. Central European time on Thursday next week. And next week's session is going to be called Lessons Learned in Locally Driven Supply Chain Capacity Building and Learning, Cold Chain, Warehousing, LMIS, EVM, and COVID-19 related country examples. And the EVM component of that, I believe I'll be involved in. So you'll be hearing more from me around that next week, I think. And I should just say, I haven't mentioned it before, but I'm not actually Alex Pascuto as I appear to be in this Zoom meeting. I'm deputizing for him because he's on a training day today. I'm Dan Brigden, WHO EPI TechNet manager. So with that, I think I'll close, and just to thank once again our participants and our presenters, and see you all next week. Thank you very much.
Thank you.